Welcome back, guys. Another episode of AltMed. We are absolutely thrilled today. I've got my co-host as usual, Mitch. Not as thrilled about that, Mitch. No, I am. You're great. But I'm really excited to have Darryl Davies from Cannvalate on. Darryl, welcome.
Thank you. It's a pleasure to be invited and very much looking forward to having a chat with you guys.
Likewise. And for all those listening, if you're enjoying our AltMed series, please remember to hit subscribe on all of our channels. I think we are expanding our footprint across lots of channels. So wherever you get this, YouTube, LinkedIn, just give us a like and hit subscribe. Right, straight into it. Darryl, maybe if we could start by dealing with your journey into this space and telling us a little bit about Cannvalate, if you could.
Sure. Yeah, I can talk to that. So it was about 15 years ago that I started working in harm minimization. So I was working with a range of different patients in a psychology and counseling point of view, in particular that had issues with substance misuse. And one of my key areas that I was focusing on was, in fact, cannabis. And this was back in the UK for a company named Add Action, which is the largest charity that honed in on that particular area. So it was kind of there where I really got a slightly different insight into cannabis use and some of the benefits, and of course the flip side, where people felt like they had issues with dependency and psychological dependency to cannabis, and some of the negative experiences associated with use as well. So that's kind of where I got, I guess, my first taste. I then worked for a range of different not-for-profits. I guess my focus was always on helping people. I moved to Australia in 2011 and started working with an NGO that was looking after kids in out-of-home care. So I was a social worker there and case manager looking after kids that were in out-of-home care in both foster care and residential care. And I finished up there looking for a new challenge, right? And I think many people change industries now. They look to move and completely switch up. And for me, I knew that I needed to try something else. And I quite liked, in the final parts of being in the sort of NGO space, I liked the corporate partnerships. I liked some of the philanthropic side, working with event management as well. There was a range of things that I was doing there that really caught my attention. And then I started to learn more about the cannabis industry. I had one friend that had started working on the policy side of things and had some exposure there. I came across and worked really just sort of in a voluntary capacity initially. I attended a few seminars and a few events, and then it was the sort of thing that the more I heard and the more I kind of got involved, the more I was drawn in, and the more I wanted to learn, and the more I could see that actually, if this industry really gets some traction here, it has an opportunity to change the shape of modern medicine. So for me, then I just ran at it, did a few different opportunities as they came up, ran a couple of events, and I worked with an Israeli company called Can10, which partnered with a couple of different universities. I ran one in Sydney, and this was a leadership program for anybody that wanted to get into the cannabis industry. So then it was a pretty small community. I invited speakers from all different companies and put on this event in partnership with the uni. So there I got to meet some fantastic people and got to hear some of the journeys that other people were on. It was a really eclectic mix of participants and students that were involved in that as well. Everybody from sort of GPs through to aspiring cultivators and really everything in between. But it was there where I met my founding business partners at the time, Asaf Katz and Dr. Sudagawal. We realized that there were many issues with the industry, and there were many obvious solutions that could be deployed to really propel the industry forward. And we saw the biggest opportunity being in the late part of the value chain of cannabis. And that's where the name Cannvalate was born as a result. At the time, there was many cultivators, many people aspiring to hone in on the early part of the value chain. And we decided the late part of the value chain is where we were going to specialize. And that took a few different forms, primarily around patient access, working with the medical community to educate them and get them familiar with the concepts of prescribing medicinal cannabis for their patients.
I mean, there's too much.
Soaking it all in.
Yeah, look at Mitch and I just completely absorbing all of that. Mitch, I'll let you go first. I've had a bit to say already.
No, that's fantastic. I think, you know, when you think about it, that we're dealing with an industry, I guess, medically, where doctors traditionally haven't been taught anything about cannabis and come from a world where not only were they told cannabis is not something you can prescribe, but it's actually not effective, and there's no clinical data out there to suggest that it would be effective. And now we're starting to see that kind of tide changing. So I guess it's comes down to those late value chain providers to educate and actually provide that value to the entire community as a whole. So from that perspective, we definitely thank you.
Yeah, I think at the time there was probably a little over 500 prescriptions that had ever happened. So there was really very few patients that had accessed, and if there was nobody there to really demystify that process and give prescribers confidence in trying this area of medicine, and we weren't the only ones. So, I mean, there was other people that were focused on that as well. But without that, then I guess there's no data, and without data, there's really sort of no industry, really. So yeah, we recognize it as being important.
Yeah, your background is in social work, I think, is also really interesting because, as you said, you'd been dealing with people who had chronic cannabis use. Some might call that self-medicating, but
yeah,
that would have, I think, contributed to just a more worldly approach that you and your business partners had in those early days to just realizing the types of people that might be seeking access, you know, and all of that. Did you draw on those experiences much, or is that kind of a chapter for another?
Yeah, I do. I mean, I didn't make it sound very exciting, but essentially people were coming to us with problems, and it was really problems where they had psychological addictions to a range of different substances. Cannabis was just one of those. But the lens in which we would, I guess, help those individuals was always looking at harm minimization. So I think from that standpoint, I definitely sort of carried that forward, and knew how important it was for the industry to have a very medicalized image, and make sure that we could get, I guess, the support of as many doctors and medical advisors as possible very early on.
Yeah.
So I think definitely one of the questions I imagine a lot of the patient cohort might be interested in is how does a doctor get educated in this day and age? Like, how does that process work? Is that, you know?
Yeah, so for us, we were quite fortunate to work with Dr. Gao Wong, who is our Chief Medical Officer. He's also he's a medical doctor himself, but he's also a lecturer for other doctors as well, so a medical lecturer. So in terms of, I guess, his particular skill set, very, very experienced when it comes to education. And it's doctor-to-doctor education as well. So obviously that holds a lot more credibility. And he was, I guess, pivotal in being able to educate many doctors. I went on the road with him several times, as with a number of different speakers to regional areas as well, and just started to kind of plant the seed, excuse the pun, but just trying to get them familiar to hearing that, okay, the therapeutic application of cannabis does exist, and potentially that's something that I can integrate into my own practice, especially for patients that have conditions where they just don't have any options in terms of medication, really, or very few options in terms of conventional treatment, or they have side effects from their current medication. Yeah, there was definitely a need to have doctor-to-doctor education back at that time. I think now there are a range of forums where doctors can learn more information, and that's great from a diverse range of people. But back then, it needed to be very clinically delivered for it to be heard.
Yeah, I think doctors, generally that empirical evidence piece, they hear a lot of things that claim to be certain things without that data, or without somebody with that type of clout that has the experience and the kind of I guess, stature of a medical lecturer potentially. Otherwise, they're not interested, I would say.
Yeah, and the side effect profile was always a big win, because compared to some of the other medications they're prescribing, it's virtually non-existent, and therefore the risk just simply wasn't really there. I mean, especially for Schedule 4 CBD, it seemed to be relatively easy to convince a doctor that they should at least be looking into this area a little bit more. They should understand how the endocannabinoid system works. They should understand a little bit more about how that could help their patients. And I think certainly early on there was this belief that the medical community were pushing back and that they weren't accepting. And certainly from my experience, it was very well received. They were crying out for information. They really wanted to learn more and work out if this is something that has legs moving forward.
Yeah. And I think with Cannvalate obviously has several different specialty functions. I'd say maybe we'll finish off a little bit more on the stuff that might interest patients, but I'm also very keen to explore some of the B2P functions that you offer over there. But I might just finish off. I was curious in terms of the types of products for patients that are listening out there. What are the kinds of things that doctors? How is the experience from a patient perspective likely to play out if somebody were to come to Cannvalate to find out more about being prescribed cannabis?
Okay, yeah, so from the patient's perspective, they've really got one of two options. They can either have a discussion with their existing doctors, and we always recommend that. It's not like we're a service that is working in isolation. We always make a plan and reach out to the doctors that are involved in that patient's care. So they can have a conversation with their doctor, let them know that a service like ours exists. We receive referrals from doctors nationally. We've got a network of a little over 3,000 doctors that refer into us. And then we provide something of a specialized service whereby there's other doctors that we work quite closely with that will accept those referrals and provide consultation. So that's pathway number one. Pathway number two, we do get a lot of patients coming to us directly, and then they look to get our support with having those conversations with their existing doctor as well. And so, yeah, they're the two main pathways in which patients can come to us. But we certainly got inundated and still continue to do so with inquiries. Eligibility, we do get some patients that come to us and they don't have a medical condition or a medical diagnosis, I should say. That is a challenge, especially when putting in a submission to the TGA, it is a challenge there. So patients will need to have a medical condition, and they need to have had that for at least 3 months and longer. And it really strengthens their case if they've tried multiple different things as well. So ideally other prescription medications, and if they haven't worked for patients, then that will be a strong case for doctors to put forward. But equally, we get some people that have tried a series of other things to try and manage their symptoms, and they've failed as well. So yeah, I guess they're the two pathways in which patients can come to us. We then provide a service whereby they can have a free consultation. It goes on for about 15 minutes. They can learn more about our process and the various different steps. They can learn more about the types of medication, some of the costs and those sort of things. And then we book them in at the end of that with an experienced cannabinoid prescribing doctor. And then that telehealth consultation will follow. So that's a bit of an insight into our process.
And is it I know certainly Mitch and I have spoken quite a bit on this podcast just about at least from the data that gets released by the TGA for which indications are being approved for medical cannabis. And I think, chief among them, the big three: sleep disorders, anxiety, pain. But I'm just interested, given the volume of patients that Cannvalate has worked with and helped, have you got any sort of insights into some of the other indications that might be lesser known that you've been able to work with patients for?
Yeah, so I guess pain is a very broad category. The applications that are often submitted focus less so on the primary condition, but more so on the symptoms that result from that condition. And what you'll often find is patients that are suffering with chronic pain do have sleep-related issues as well. So there is a degree of consideration that there's multiple symptoms and multiple things that are going on for any patients at any given time. So really it's the role of the doctor to paint that picture when putting forward a submission. But I think some of the other areas, just to hone in on things that maybe sit outside of that, to answer your question, we get a lot of patients that have Crohn's disease, actually. And sort of inflammatory gastroenterology related issues. So that's an area. Neurological pain as well, and movement disorders. We do get quite a big volume of patients coming through with those sort of conditions. But yeah, some of the other things there, anxiety and primarily pain. Arthritis is in there too. Just to think about, that's actually a pretty big one. So yeah, there's a bit of a diverse range.
Yeah, nice.
Fantastic. I think, definitely I'm very keen to learn a little bit more on this podcast about some of the B2B functions of Cannvalate as well. I think that's something that maybe less people out there know about, especially the general public, in terms of what happens a little bit more behind the scenes between companies. I mean, obviously there'll be a lot of stuff you can't say, but that which you can, we'd be very interested to know about.
Yeah, sure. I'll give a bit of an overview here. So I guess in the B2B or space, we offer storage and distribution, so warehousing and what's called 4PL, which is safe storage and delivery of cannabis nationally. So that's a service that we provide. We also help licensed producers define their USP. We help them with collating packs that are suitable for the medical community. And we're actually responsible for presenting that, for updating some of the formulary that we have available to doctors for them to order through us. So for licensed producers, we can store and have their medications available on a formulary so doctors can make selections through our network. So that's quite appealing for a range of different licensed producers, both domestic and international. I guess the second side of, or the second pillar, if you like, of what we do, and something that is lesser known to the wider community, is we do have a CRO, so a clinical research organization. We are a registered research service provider, so we do provide clinical research to really support the clinical validation of the products that are available in the Australian market. So we've got a range of clinical trials that are going on, from phase 1, phase 2, phase 3, the Schedule 4 recent developments. We've had a lot of interest there and secured a number of contracts to research in this area. So the way that we operate there is we partner with universities. It's all university-led research, but we represent the, I guess, the client-facing work, and we enable then the researchers to do what they do best, which is focusing on trial design and trial execution. So that's the second pillar. The third pillar is market entry work or market penetration. So we look to work with other companies that are pretty mature in overseas markets, and we support them to expand their footprint into Australasia, essentially. So one of the best examples of that is our relationship with Valens. Valens are probably the world's leading cannabinoid manufacturing company. They're based in Kelowna in Canada, and they've got a very sophisticated operation there, supplying all sorts of products to mainly to feed into the Canadian recreational industry, everything from gummies to beverages and vapes. They do a lot of vapes there as well. Yeah. So yeah, that's a really interesting relationship, and we're bringing them over to Australia. And we have a 5-year contract with them to essentially be their advisory and boots on the ground to ensure that their entry into the Australian market is well managed. And that's really quite advantageous for international companies that do not understand the regulatory landscape here, and they just need some hand-holding to get that right.
Amazing. I'm sure there's some potential patients out there listening to that and going, okay, Daryl, so which doctor can I go to get a prescription for drinks and gummies? And
yeah,
I'm not sure if such doctors exist that would be prescribing those products.
Yeah, it's quite a strange area. I mean, we've worked with a number of companies that have said, okay, I want to bring this product in. And we have to politely remind them that doctors are not too comfortable prescribing 3 jelly babies as part of their prescription. You know, the sort of products that we have available in the Australian market are complementary to it being a medical market, but the landscape may change, and as and when it does, then Valens are going to be exceptionally well positioned to cater for that recreational market, but they are also expanding to have a range of products available for the medical market as well, and of which we have a number of those already selling and doing very well with Australian patients.
I imagine the Australian operation for a company like Valens would really bolster the medicinal kind of operation back in Canada because of the reputation of Australia clinically as a pharmaceutical outfit in some degree, or the level of pharmaceutical compliance and stringent kind of protocol you have to follow to actually even register a product here is just insane.
Yeah. And even looking at some of the registration process in New Zealand as well, to have products available there, it's extremely strict. And I guess the Canadian side of things is they've reached that level of maturity. They have a wealth of experience. But if they can bring that experience into the Australian context, I think it's really going to play a role in propelling the industry forward. And look, you guys would know this sort of better than most, but there's a range of different licensed producers that have some really ambitious plans in Australia. And even if, say, a quarter of those plants come to fruition, then they're going to be relying on manufacturing relationships to better service that type of volume. I think the days of vertical integration, where you get these companies that are growing a plant and they want to do everything through to then looking after a patient. Australia's lucky in that we already have a playbook to work from. These guys did that 10 years ago. So we can look at what worked in Canada. We can look at how things have evolved, and we can create a new and improved version of that in the Australian industry.
Yeah. And how much of that do you think comes back to stuff like clinical trials and the data on the medicinal side of things?
Yeah, great question. I mean, I think, to be honest, my personal opinion is that is the most exciting area. It's about building out defensible IP. You see some companies that are looking to bring, I'm going to call it a generic product, a generic, say, CBD product to market, and they haven't really necessarily thought about some of the longevity of having that sort of product available. I think some of the research side of things is fascinating, whereby I guess academics are able to look at, okay, well, what does the data talk about in relation to certain conditions or indications? What's currently out there, what's working well out there, and how can cannabis be complementary to what's already working? And then you've got some of these sort of synergistic opportunities for drug development, which could see cannabis really playing a role. And there's a number of biotechs that are really strong on this and keen to build out a patent library and are really pursuing that individuality to help them in future, because they recognize that that's ultimately where it's all heading.
I find it's a really interesting landscape in Australia at the moment. You've got I'm very much in favor of getting the clinical data out there and testing and obviously going through the trials to prove the efficaciousness of these medicines. But sometimes I find myself, we take a very holistic view of the landscape in Australia at the moment. Sometimes, you're talking to people and they're like, I can't afford the prices of cannabis at the moment, and I can't. You can get it overseas. I was getting it in America, or I was getting it in Europe for, $30 and just smoking weed. So, and I find myself torn between wanting to, like, the amazing medical system that Australia has versus the, like, well, at the end of the day, it is kind of a plant that grows in the ground, and why shouldn't people have access to it in a recreational form and, be able to treat themselves in the interim whilst we're trying to also define how that helps on a clinical level. Do you find it all, yourself thinking about that?
Yeah, I'm maybe just, I guess, leaning back on that question around the B2B side of things. We get some licensed producers that come to us and go, we have this particular strain or something that they're looking at that they feel is particularly beneficial against a certain condition. Right. And they want to, I guess, back it up with a series of different operations. Let's call it soft data outcomes, whereby they say, look, we want to see what it's like across 1,000 patients. So can we lean on the Cannvalate network to achieve that outcome? And we'll look at some of the data that is a result of that and let that help inform some of our decision making. Equally, they would then look at engaging a clinical trial program to help further validate that. So I think it's interesting where, yes, you have the ability to be able to grow a plant at home, and you can control the environment. There are some benefits to that, and I'm sure a lot of patients do elect for that avenue. But when it comes to looking at specific conditions and then the the hundreds, if not thousands, of different options that you would have for various medications. And then it becomes a data problem, and you get people like Dedi Mary in Israel, who I'm sure you've come across, who is managing this exact project. He's looking at, I believe cancer is his main focus, but he's looking at data, and he's going, okay, there's all these thousands of different options in terms of cannabis, and then you've got thousands of different types of cancer. There's no one type of cancer, and then he's trying to match up everything and really play that game of marrying up particular products against particular conditions, and that's where it starts to get really interesting. Because if we can focus on that area and we can show some insight there, then that's really going to change people's lives, and that
I agree with you.
That can't be done in a backyard, basically.
No, I totally agree with that. You're 100% right. And we've kind of briefly talked about this topic, but I think we can go into it a little bit more here. Like, obviously people talk about the entourage effect and the synergy of different compounds working in different strains of cannabis. So you get, different minor cannabinoids, different terpenes, things like that. Yeah. But I guess at the end of the day, it's all just science that we haven't yet understood fully. So there will be a ratio of CBG or myrcene or limonene that together with CBD and THC is actually really effective for Parkinson's. And then there's one that has a bisabolol and CBG that kind of works really well for, irritable bowel syndrome, for example. You find that there will be these combinations that we just haven't fully extrapolated on yet, that we currently just say, oh, well, it's the entourage effect that is getting a better result than, say, a CBD isolate, for example.
Yeah.
So I totally agree with you on that.
Yeah, and even then, I mean, we look at some patients that are have pretty much the same condition. They may have the same demographic data. We get one patient that 3 weeks into their treatment, they've completely stopped all their prescription medications, despite doctors advising that they shouldn't. They've elected to do that. They've had fantastic results. Yeah. And then you've got the other person that had the same medication that really isn't getting anywhere near the same level of results. So yeah, it is interesting, and that's where I think data will save the day, really. But maybe you're right. Maybe we just don't have enough of it.
Yeah, well, I think, because of the checkered past of cannabis, I guess it's definitely been one of those.
Normal anecdotal data.
Oh, there's a lot of that.
That term gets thrown around a bit, doesn't it?
Yeah, it doesn't.
Yeah.
One of the caveats you've got, well, anecdotally, we've seen these responses to YZ product, and
anecdotally, I've actually seen you have a medicinal response from time to time, Mitch. Actually, but I think we might wrap it up there. I do anticipate, if you're comfortable with this, not to ambush you, but we'd love to get you back on, Daryl, as we track the journey of everything that you've got going on. It's really exciting to have both a business that caters and services patients, and then also other really sort of heavy hitting key industry players here in Australia, and the international advisory work that you're doing. It's really exciting. So we'd love to chat again in future.
Yeah, I feel like I could talk to you guys for days. It's just whether anybody else finds this interesting is the main issue. But hopefully they do.
30 followers, we love it. So
yeah,
I hope that there's some, maybe we can call it the value chain for AltMed. But there's a few people who have told me that they're actively listening for maybe 4 to 5 minutes per episode. So that's an improvement on where we were.
And they're definitely missing out on my favorite now kind of question to ask right at the end. How long from this point do you think it is until, if ever, we see recreational cannabis in Australia?
Yeah, it's a loaded question, isn't it?
Are we going to put together some sort of compilation, Mitch, where we assemble all of the responses that we've received to this question,
and then we give them a prize to whoever's the closest?
Yeah, well, I think I like to refer to medical access as a gateway legislation. So I think the recreational will come. I do also acknowledge that it's hard to pinpoint an exact timeline for that. I think some of the regulatory shifts that we've seen have happened sort of overnight. I mean, there was a shift where then we were able to export, and nobody saw that coming. Look, I would say 5 years is probably where I feel comfortable. I think it's somewhere between 5 and 10. Some people may have an opinion that it's going to happen much quicker, but there's so many considerations in there. I think the industry can't be ignored, and now is a really exciting time to be in this industry because it's almost getting to that stage where we have such rapid growth that's happening, and rapid awareness, and you've got patients that are just advocating for this, and they have been doing so for such a long time, but now they're starting to yield results from that effort, and things are really starting to advance here. But then some of the, I guess, the regulatory and political considerations that go with a shift to recreational, it's a tough one. Is that a cop-out, going 5 to 10 years? I mean, will I say 8?
I mean, yes, it is, but
we will remind you of this answer when it finally happens. But no, I'm planning to, it's a topic for another episode. We're going to unpack the legal pathways to getting to recreational, and some of the political considerations, because as much as everybody might think that, it might just happen, one state decides to go recreational and the others follow, it's not quite that simple, due to Australia's status as one of many countries signatory to a range of international treaties. So we've got, there is work to be done, but maybe I'll bore everyone to tears by sort of walking everyone through those pathways on a future episode.
I'm sure there's a few people moving to Canberra as a result of some of the developments. Again, that's another one. I wouldn't have seen that coming. I wouldn't have guessed that would be an evolution in from an industry standpoint.
That you can grow plants in.
But it's sort of, I sort of wonder if it's for the benefit of federal politicians at the end of the day.
Possibly.
In Canberra that they go to when Parliament is sitting, and I imagine all of them have got a range of plants on the balcony. And
how else do you come up with policies like that?
Exactly.
It's true. It's that was a strange one, but who knows? I mean, that could roll out to other states in a lot less than 5 years, but it's yet to be seen.
Oh, man.
All right. That's definitely time to shut shop on this one.
I have to set up a counter on this one. But all right. Well, no, Daryl, thank you so much for your time. You'll be a dad, I think, the next time we get you on for this. So congratulations for all of that as well.
Thank you.
But we'll stay in touch, and just really look forward to tracking your development and Cannvalate's development. We massively appreciate your time and insights.
No, thanks for the invite, and I've really enjoyed it, and I'll continue to follow everything that you're doing at AltMed. So, thanks, Andrew. Thanks, Mitch.
We'll speak.
Oh, cheers.